Topics in this video. What is hypoxia? Definition. Types of hypoxia. Causes of hypoxia. Sign and symptoms of hypoxia. Definition. Hypoxia is a state in which oxygen is not available in sufficient amounts at the tissue level to maintain adequate homeostasis. Or, hypoxia is low levels of oxygen in your body tissues. Do you know what is anoxia? Where oxygen is entirely absent, the condition is called anoxia. Types of hypoxia: hypoxic hypoxia, stagnant hypoxia, hypemic hypoxia, histotoxic hypoxia. Most common type of hypoxia occur in aviation. Hypoxic hypoxia occurs when not enough oxygen is in the air, or when decreasing atmospheric pressures prevent the diffusion of O2 from the lungs to the bloodstream. This is the type that is most likely to be encountered at altitude. The partial pressure of oxygen, as it is presented to the blood within the lungs, is too low to effectively carry and transfer enough oxygen to the cells of the tissues. Can be resulted from altitude exposure, strangulation, compression of air passage, cause the respiration arrest, other failure of oxygen system in aircraft, improper use of equipment, failure of depressurization system. Stagnant hypoxia occurs at circulatory level, a condition that interferes within the normal circulation of blood arriving at the cells. An arm or leg going to sleep because the blood flow has accidentally been shut off is one form of stagnant hypoxia. Causes of stagnant hypoxia can occur as the result of G-forces from maneuvers, mostly aerobatic aircraft, disease of the blood vessels, cardiac heart arrest, shock, exposure to cold, sudden change in posture. Hypemic hypoxia occurs at blood level, an oxygen deficiency due to reduction in the oxygen carrying capacity of the blood low hemoglobin. Hypemic hypoxia caused by anemia, a deficiency of red blood cells, bleeding, taking some prescription drug, * blood donation, other, smoking, cabin contamination with engine exhaust fume. Histotoxic hypoxia occurs at cell level, interferes with the normal utilization of oxygen into the cells. Plenty of oxygen is being transported to the cells that need it, but they are unable to make use of it. Tissue cells are poisoned and unable to use oxygen, caused by alcohol and drug. Sign of hypoxia: increase in depth and rate of breathing. Cyanosis, a blurry effect of the skin, most noticeable on the lips and the fingernail. Delayed in reaction time, poor judgment. Symptoms of hypoxia: air hunger, a feeling not enough breathable air, feeling of fearful or anxiety, nervousness, mental confusion, fatigue, nausea just before vomit, headache, dizziness, hot and cold flashes, visual impairment, color vision, night vision, blurred. Why important to recognize if hypoxia is prolonged? Serious problems develop with ultimate death, in extreme cases prior to death. Some brain cells are actually killed, and they cannot be regenerated. The single most dangerous characteristic of hypoxia is that if the crew member is hypoxic and engrossed complete attention in flight duties, the pilot might not even notice the impairment.